Right. Well, welcome everybody. This is Eliana Ceramos White. I am from AMCHIP, the Association of Maternal and Child Health Programs. And thank you for joining us on a Friday afternoon or morning or whatever your time zone may be at this time. We're going to discuss a little bit about Title V, which is specifically how the Maternal and Child Health Block Grant Program can really advance adolescent health. And this idea actually was generated because AMCHIP and the National Network of State Adolescent Health Coordinators, every 2 years we convene an orientation for new adolescent health coordinators or those that are kind of filling the role of managing the state health department's priorities related to adolescent health. And typically during that orientation, we do a little bit of a side note around like what AMCHIP is, what is Title V, how does that matter, what does that mean for my role in adolescent health? And we felt that, it's great for the orientation, but it's always a nice refresher for other adolescent health leaders who may not have been part of that orientation or just need to have a little bit better understanding of what is this federal legislation, what does it mean when it comes down to programs and activities, and also just what's some innovation behind it. So this is kind of going to be a little bit of a casual conversation. I'm a health educator by nature, and my background is in MCH, and I'm all about keeping things simple. So there's plenty of resources out there to kind of fill you in on some of the history or some of the nuts and bolts of this legislation, but we're going to keep it kind of high level so that way we can discuss, some of the more salient items that are going to be relevant to your work and also some of the emerging adolescent health needs. With that being said, I like to think of this as a family affair and not an embarrassing family affair. I know there's probably some of us that have family members that we don't necessarily like to say that we're related to or that may really embarrass us, but I don't think that's the case in this sense. I think that this is a true family partnership in which we learn from one another. There's trust, there's guidance, there's role modeling in some cases. I know I probably didn't pick the families that we would want to model after, but there's a lot of love and there's a lot of support. And I like to think of Title V as being an assortment of families that are brought together for maternal and child health. And so with that being said, we're going to explore a little bit about those family dynamics today. I want to leave off first by saying thank you to the network. And I see the network as the cool cousin. And what I mean by that is just AMCHIP and the network really work hand in hand. I will say that there is so much trust. We have a lot of shared experiences, as you may have with your own cousins. The good thing is there's no sibling rivalry. There's no competition. It's really about, enjoying one's company, learning from each other, and just really being part of that development. The cousin always looks out for you, so we look out for one another, and we are very candid, and we like to tell it like it is. We like to share, oh, this is a really cool idea that's coming out of the state, or this is a significant challenge and it's frustrating. And some of the other coordinators are going through the same thing. So I like to think of the network as being truly the cousin to AMCHIP, and I would hope vice versa. But the cousin is truly the favorite partner in crime. So when we think about this family of Title V, the matriarch has to be MCHB, and that stands for the Maternal and Child Health Bureau that sits under the federal HRSA administration, which is the Health Resources and Services Administration at HHS. And so when you think about the matriarch, picture it. It's an America where all mothers, children, and families are thriving and reach their full potential. And actually, this is the vision of the Federal Maternal and Child Health Bureau. And one way that they execute this mission is that they support state and jurisdictional health departments through the Title V Maternal and Child Health Block Grant. So Title V is actually not just something very new, but something very much seasoned. And it's actually 85 years young, I like to think. And so you're going to get a quick, very quick history lesson. So Title V actually was born out of the focus on child welfare, specifically child participation in the labor force back at the turn of the century. And so actually in 1912, there was the U.S. Children's Bureau, which was first established. And actually, you can see this visual on the right-hand side. I think that this is the same exact artwork that sits in MCH's office as a reminder of children are truly the most valuable investment in America and in our society, and we have to continue to invest in them in order to thrive. So Title V, as we know it, was signed into the Social Security Act, passed into law under the FDR administration in 1935. It underwent some, various changes over the years. It became, it definitely grew or definitely reinvented itself, I should say. In 1981, under the Reagan administration, it became the block grant that we know of today. In 2015, we saw this transformation, like an MCH 3.0, and this was really focused on kind of changing like how states were going to focus on maternal and child health priorities with an added focus on accountability and measures. And we'll get a little bit into what that means. And then, of course, 2020 showcased the 85th anniversary of this landmark legislation. So the purpose of this Title V, again, it is the longest standing legislative mandate focused on improving the health of all mothers' children, and this includes adolescents. It's guided by the life course framework, so the understanding that you don't focus on improving outcomes for adults by just what they're experiencing now, but looking at preconception, what happens in preconception, what happens to the health of the mother, the father, the environment in which they live in, and continually investing in priorities across their development throughout life. And again, it appropriates funds to the states to focus on ensuring that there's access to these health services, also making sure that there are these services related to preventive and primary care, and then also a focus on transitioning from pediatric to adult healthcare systems. So Title V is kind of like that rich uncle. And what I mean by that is that in fiscal year 2018, Title V was responsible for investments that were well over $6.5 billion for women, infant, children, adolescents, and also children, youth with special health care needs. And the $6.5 billion, I want to say, is the full amount that's taken both federal, state investments and investments from other funding sources. But again, it's a significant amount of funding that supports the health and well-being of these populations every year. The federal allocation in fiscal year 20, which just ended, was $687.7 million. And the ask that MCHP specifically is trying to advocate for fiscal year 21 is $718 million. So that we're yet to see if that's going to go through as planned. However, this is something that, it's a significant chunk of change that is invested every year through this federal mandate. And on the left-hand side of your screen, what you'll see is kind of the percentage of the MCH populations that are served in one way, shape, or form by the work of Title V. The middle bar showcases the reach for children 1 through 21. And unfortunately, we're not able to pull apart and break this down even further into how much of that, over 50%, is truly adolescents. But again, it shows that, you're reaching half of the young people in this country through this legislation. And one thing I want to mention regarding investment, there's a match and then there's a formula. So the federal allocation to each state and jurisdiction is based on population size. and not any other factors such as poverty, for example. So for instance, Palau may get the least amount of the federal allocation, but that's because they have the smallest MCH population size. Whereas New York and California get the most, obviously, because their population is significantly larger. With that being said, regardless of what the allocation looks like, the state must match every $4 of that Title V federal money by at least $3 of non-federal funds. So again, that's a match that's embedded in the legislation. And then you'll hear this 30-30-10 formula that's shared, which is basically saying that of the Title V funding, 30% has to be used for primary and preventive care services for children. 30% must be devoted to children with special health care needs, and then you cannot exceed 10% towards administrative costs. So it's at least 30 for children, at least 30 for children with special health care needs, but no more than 10. So when you hear that 30-30-10, that's what we're referring to. And with this amount of money and funding and this mandate, there's measurement or accountability. And so what this does is that through this program, states have an option to select these national performance measures that cover across the entire MCH population domains. And so they have to select at least one performance measure that they're going to report on and guide activities towards under each MCH domain. So for example, there are 15 national performance measures, and there's 5 population domains: women, maternal health, infant perinatal health, children's health, adolescent health, and also children with special health care needs. So they have to select at least one performance measure. Some may choose 2, some may choose it to 3, but it's at least one national performance measure that everybody's going to be reporting on across the board. Now, with that being said, sometimes these performance measures may not capture what's happening or what is another priority area for the state. And in that case, and this is kind of the beauty of the flexibility, they can come up with their own performance measures that are going to further address some priorities that aren't necessarily seen in the performance measures on the national level. We'll get a little bit more into what that means. There's a question around, does children mean 1 through 18? Great question, Tessa. So children, under the way that they report the data from the Bureau, is age 1 to 21. So there's a little bit of a young adult mixed in there. Also with Title V, again, Title V is not responsible for handling all the healthcare delivery that needs to be offered to mothers and families and adolescents, but that there's a real emphasis on coordination of services using this funding. So looking at how Title V is embedded in systems that serve maternal and child health populations. And then I think of, like, when you think about like Living Single, that sitcom in the 90s, I think about there's different roles and personalities that Title V can take on when it comes to these population domains. So for instance, Title V can help directly fund some programs across the state. They can support other existing programs by offering their expertise or their networks. They can lead, statewide or be part of national initiatives, or they can definitely partner on with other entities that are focusing on subject matter that's still very relevant to them. So for instance, serving on task forces or councils that address a specific subject matter. So like with our own families, there are those times of the year, or the decade, I should say, as well, in which we get together. So there are some annual gatherings, and then there are some of those reunions that take place maybe more sporadically, or maybe more frequently. So on the left-hand side, you'll see that there is the year of 2020. Now, aside from being a very interesting year in and of itself, 2020 serves as the latest starting point for the 5-year needs assessment for the maternal and child health block grant. Every 5 years, Title V programs are required to conduct a needs assessment that's going to drive what their MCH priorities are going to be over the course of the next 5 years. So previously, the state submitted their needs assessment findings in 2015, and that was supposed to guide them for their block grant activities at a high level throughout 2020. And then this year, they were going to submit their latest needs assessment findings to inform the next 5 years. And this is a very critical piece because this is a process that does not happen overnight. Some states were starting their needs assessment submission for 2020 back in 2018, for example, because it takes time to mobilize the data collection methods, how you're going to involve community stakeholders, how you are going to analyze the data, and then how are you going to use that information to inform and ultimately select what your priorities are going to be moving forward. And in the middle, you'll see July 15th. And I put an asterisk because July 15th serves as the deadline for states to submit their block grant application that showcases like what are they going to focus on in the upcoming year. It's also, as part of that application, an opportunity to provide their annual update for the previous fiscal year on what happened under the MCH Title V program. What were some of the achievements? What were some, how was the funding spent? What were some new programs that were initiated? What were some successes? So it's kind of the annual update and the application due date. And sometimes July 15th falls on a Sunday or a Saturday, so it'll be the next business day. In this case of 2020, the states were offered an extension because of the COVID-19 pandemic to submit their application September 15th. So we're a little bit behind in getting that information, but nonetheless, this is a critical date because it's, it starts to give us an idea of what's happened over the past year and what are we going to need to do to mobilize our networks for the priorities that they've identified in the upcoming fiscal year. And even though we have these two key milestone dates within every year and within every needs assessment cycle, the states are constantly assessing, what are, the measures and the metrics and the data and their efforts related to their priority areas across the MCH domain. So just because they perform a 5-year needs assessment doesn't mean that they're not continuously assessing, what are some emerging trends? What are some things we might need to shift at this point or pivot? For example, the states prior to 2020 last submitted their needs assessment in 2015. Well, in 2016, Zika happened, and nobody was expecting that. So of course, they had to shift some of their priorities to the response related to the Zika outbreak. But again, that just kind of shows the flexibility. Some of their priorities may have still stayed the same because they still prioritize them moving forward, but then they may have had to add some things related to emergency preparedness and response, or just dealing with this pandemic that was affecting pregnant women in particular. So again, just an example of there are these milestones or these intermittent deadlines. However, the work is continuous throughout the year. So again, with the federal allocation, the state match, and the partnerships that's really supported through Title V, there's a measurement framework to look at how are we being accountable and good stewards of this money, time, and resources. And so, and this is a little bit of the alphabet soup. I won't get too much into that, but I'll mention that states select these priorities based on what the data, the needs assessments are informing them of. And then from there, they look at what are those performance measures that are outlined by the Maternal and Child Health Bureau that relate to the priority areas that they want to focus their activities on. And again, if there are priorities that aren't serviced well enough by these performance measures at the national level, the states can create these state performance measures, or SPMs. On the left is ESMs, and this is really just a fancy way of saying, how do you measure the strategies that are going to improve those national performance outcomes, those national performance measures, so that way you are getting to those national outcome measures. That's kind of on the right-hand side. So we won't get too much into that because I think that can get really convoluted. but just know that there is a measurement framework for how do you take this legislation and this investment and look at how are you creating impact across the population domains. So I mentioned that there were 15 performance measures, national performance measures, and I'm going to highlight the ones that kind of fall in the child and adolescent health domains. And I say that because some of these may be relevant to only adolescents, and some of them may be relevant to children and adolescents. So for instance, there is a performance measure related to, a national performance measure related to reducing unintentional injury, increasing adolescents who are physically active, reducing those that are bullied, reducing the number that are bullied or who bully others, increasing the rates of preventive well visits received by adolescents, also focusing on how effectively children and youth are transitioning from pediatric to adult healthcare systems, and then also ensuring that children are adequately insured. So again, these are those national performance measures that fall into the child and adolescent health bucket. And with Title V, I will say that when it gets to adolescent health, this may be honestly probably one of the biggest learning curves. And what I mean by that is that there may be some really great partnerships and infrastructures to support maternal health, infant health, children, youth with special health care needs, but sometimes adolescent health can get a little muddled. And it could be for a variety of reasons. But again, there's still opportunity. I don't think that there is, I'm trying to find a way to say this accurately. I don't think that you will get a complaint of Title V being too invested in adolescent health. I think there's always gaps and opportunities that Title V could support when it comes to the health and well-being of young people, and ways for them to grow its capacity and its footprint in this space as well. So I'm pulling the priority areas that were submitted with the last needs assessment, and the reason I say that is because the 2020 needs assessment was submitted, as late as September 15th. So the Bureau is still analyzing the data. They're still meeting with states to go over their application. So we won't know if this list changes, but I did pull some of the priority areas that states indicated in their previous assessment. And so you can see it's really a range. Some focused on substance use, some talked about active and safe environments for adolescents, oral health care, something we might not always think top of mind when it comes to youth, looking at supporting expecting and parenting teens, suicide prevention, obesity, sexual health. So again, it's a range. It's definitely not narrow, which is great because it's showcasing there's some needs that we need to holistically address so that young people are healthy and that they're thriving. And with that being said, there was also a pretty lengthy and impressive range of state performance measures for adolescents and young adults. Again, if the state didn't feel that the national performance measures were enough to really focus their resources, or there was something a little bit more granular they wanted to address, they had the option of creating these state performance measures. And so here are some examples of what those measures centered on. Some focused on measuring food insecurity, for example, looking at child abuse and neglect, the engagement of community partners to support adolescents and positive youth development, routine mental health screening, up to date on vaccinations, including HPV, having a trusted adult in their life. I mean, what a cool measure to look at, to see if young people can identify a person that they trust to go to when they're experiencing some trouble or need additional guidance. I mean, so what I like about this is that it's creative. It allows for flexibility. But again, it gets at, this is a way that Title V can be leveraged to address adolescent health needs that may not be the focal point in some of your other funded programs. And again, these are optional measures that states opted to put in place to hold themselves and their partners accountable. So I want to talk a little bit about SPRANs. What SPRANs is another investment of Title V. So Title V, again, administers the Maternal and Child Health Block Grant, but it also allocates funds for these special projects of regional and national significance. And this is to support, beyond the block grant, projects that are focused on specific priorities or emerging issues that are regionally or nationally significant and are in place in order to improve state systems of care for mothers, children, and adolescents. And so one example I want to share that's really relevant to this group is kind of that nice matching of these resources related to adolescent health. So because of Title V, the Adolescent and Young Adult Health National Resource Center was born. And this is one of several technical assistance centers devoted to maternal and child health populations. But for adolescent, we have this resource center that is led by the University of California, San Francisco, and also includes MCHP, as well as SARC, the State Adolescent Health Resource Center that drives the network, as well as the University of Vermont's National Improvement Partnership Network. And so this resource center was specifically established to support state Title V programs and their partners, whether it's public health and clinical partners, to increase the access and the quality of preventive services for adolescents and also young adults. So it's kind of derived from that national performance measure number 10 around annual well visits, but it's not just about getting a well visit. It's looking at, is the quality of care youth friendly? Is it centered? Is it developmentally appropriate? How do we ensure that young people understand the importance of getting their foot in the door of a trusted healthcare provider's office? And with that, the resource center kind of also is flexible to adapt to emerging issues. So we are looking at, increasing behavioral health integration in primary care services. So ensuring that youth are routinely screened for mental health issues and that they're referred and they're treated accordingly. We're also looking at what does young adult health look like? What are some best practices or guidelines related to comprehensive visits for young adults, not a fragmented system of just seeing specialists or seeking care only when things get worse, for example. So again, this is one investment of Title V that's very valuable because we provide, as a resource center, a lot of technical assistance to states around what within their adolescent health domain do they want to advance, and what are some ways to do that through equity and access to high quality preventive care. So one thing I think I appreciate about Title V and its flexibility is that it gives the opportunity for state and jurisdictional health departments to not only assess, whether it's through the 5-year needs assessment or the annual assessment of that needs assessment, but look at how you address those issues that affect the well-being of adolescents and also young adults. Title V helps support the coordination of systems. Those systems are really integral to a young person's day-to-day living. Also, Title V, I've seen the opportunity to really bring that positive youth development framework to life. Ensuring that we are focused on healthy development of an adolescent, that we are assets-based, that we're looking at strengths rather than, risks or through the lens of a deficit. And I've seen Title V also just being very supportive in many cases of providing youth and young adults the chance to lead, whether it's helping to create these really robust and operating advisory councils or engaging youth leaders in decision-making or other public health functions through this legislation. So again, I think that there's opportunity to really kind of even furthermore maximize how Title V is leveraged to support adolescent health. I think we do a great job with maternal health. I think we've made some really great strides in infant health, children with special health care needs especially, but I think adolescent health, this is definitely a backbone that we can offer to support programming across the board. And because we have to understand that with different administrations, with different governors, presidents, with different ways the government is structured. Sometimes funding streams come and go. Sometimes priorities change, and we tend to maybe lose that funding source that was critical to our adolescent health programming, for example. But with Title V, is like, how do we maybe leverage the partnerships that it can create based on those priorities to continue effective strategies, to demonstrate impact, to collect the data that's necessary to ensure that the investment for adolescents is there and it continues to grow rather than recede. I want to take a minute to mention, as part of this other family structure, I like to think of one group as the parents that that your friends wish they had. And I'm going to put a shameless plug for MCHP, my organization. So MCHP stands for the Association of Maternal and Child Health Programs. We are the national membership association of all 59 state and jurisdictional Title V programs. So we reach everybody that has to deal with this legislation, that either is administering this Title V block grant in their state or working in partnership with them. So we envision a nation that really, truly values and invests in the health and well-being of women, children, youth, families, and the community so that they're able to thrive. And so we work in several different manners, whether it's leading national programs, whether it's being part of these national resource centers, like the one that's focused on adolescent and young adult health, whether it's offering technical assistance on a smaller scale, or whether it's also connecting you with other programs to help replicate effective evidence-based programming that's been demonstrating some great impact in one state, how to have that replicated in your state, for example. So it's really kind of being that parent that helps guide and raise these Title V programs into a healthy adolescent and hopefully a healthy and thriving young adult. And I do encourage you, there's a lot on our website, but if you check out our Twitter page, MCHP Growing Up, that is our handle. And that kind of focuses a lot on the resources and the programming that we have dedicated towards child and adolescent health specifically. So in summary, I like to think of, when you think of Title V, think of it as your Betty White. Something that's gotten better with age, someone that's been around, has taken on many different roles, is very versatile, and is always someone you can trust, someone that always follows through. Betty White always can give a great performance, has a range, she makes you laugh. She's always a guaranteed good time, and I think that's how you might want to think about Title V. It's just something that's very enduring, even as programs change, even as leadership may pivot towards other resources or a cut of funding. Title V can be that backbone, that trusted source that you can always return to. So again, think of ways that you might want to leverage Title V programming to advance adolescent health, regardless of what may happen, or to help cushion any sort of changes or challenges that may come your way. So in summary, Title V has a lot of great opportunities that can really be impactful for adolescents. It's really, with its current leadership, is focused on upstream thinking, a true focus on equity and social justice, and not just the equity of what mothers may be experiencing or infant mortality outcomes, for example, but looking at social justice for like the health and well-being of young people, adolescents, whether it's their physical or mental health. Title V also supports programming and initiatives related to workforce development and also leadership development. So how do you get others to create, in your agency, for example, to embrace an anti-racist culture, or to embrace a culture where you focus on science and evidence to support health and well-being? How do you find leadership that's going to advocate for effective policy change, for example? And again, Title V can be a really great resource for championing adolescent health in that sense. I don't think I don't think it's being maximized at this point, so there's great potential to see more of a footprint in that area. And I wanted to offer two websites. The latter is the Resource Center that I mentioned earlier. So this is a technical assistance resource center that is supported through Title V's SPRANS funding. So that's that link. But the one above it is the TVIS website. TVIS stands for Title V Information System. This is the biggest repository of Title V data that you can find. It's housed on the Bureau's website. And you can search for things such as like finding out, what are the performance measures that your state has selected? What are the strategies that have been put in place? What are the 5-year needs assessment findings yielding? What are the federal investments? What are the state dollars that are invested in Title V? What are other states' performance measures? I mean, this is a great source of information to just look and see the breadth and the creativity and the flexibility of this legislation. So I do encourage you to take a look at it. I know it's very helpful for me to look at what to understand a trend and where adolescent health may be going through Title V support, and then also look at, well, how is this block grant helping to support emerging issues that we're hearing from coordinators like you or from other state health professionals that are working in adolescent health programming. So I think it's a great resource, and I encourage you to take a look at it when you have some time, peruse it, and again, it's going to be continuously updated once they get the new information from the states for this block grant year. But again, it's just a wealth of information that it's really one-stop shop. So I do encourage you to take a look at that. So I want to say thank you so much for this time. I know it was a lot of information and there's plenty more to learn about it. I think you can pretty much take a whole, you probably do a whole dissertation on one part of the Title V legislation, but I just want to say thank you so much. My focus is on adolescent health, but I'm happy to connect you with other colleagues and networks and partners across, that serve across the maternal and child health population domains. And I want to say that if we're keeping with the family theme, I wanted to share this photo of me and my brother. My brother has Down syndrome, but he is definitely one of, I could easily say my favorite sibling because he is just someone that at the end of the day, there's a lot of love, there's a lot of support, and it's just a great sibling dynamic. So I just want to say thank you from myself. And there's John saying hello as well.